what you guys do is, if say somebody calls in, a woman calls in, and as a result of having seen this program, she calls in. She said, "I'd like to talk to you guys about your program." What do you do?
So I do consultations with women all day, every day. And so the first thing we need to determine is what is their status? Are they menopausal? Are they not menopausal yet? Are they perimenopausal? Because the treatment for them is going to vary. And if you give the wrong things without, and we see it all the time, without really making that determination, then you can make the woman much worse. So that's the first thing that we do. And we do that by utilizing blood work and a comprehensive medical history.
Let's say a 35-year-old gal calls you guys, and she says, I'm concerned about some stuff. I'm feeling a little weird. My skin's dried. There's just some changes that I have been told might be related to my hormone status. What would you do for a 35-year-old as opposed to a 65-year-old?
Well, we can have 35-year-old women that are actually menopausal because of a complete hysterectomy, or if they anything that can damage the ovaries.
It happens.
So it can be a surgical menopause. It can be chemo, radiation, smoking. All kinds of things can damage the ovaries. So the first question I would ask is, when was your last menstrual cycle? If she's having menstrual cycles, then the next question is going to be just about menstrual history, how their cycles have been. You want to know about that because we're screening for something called polysystic ovarian syndrome, which is a huge problem, the most common endocrine disorder among reproductive age women. So we screen for that. And then if she says, well, I haven't had a menstrual cycle in 2 years, then we have to go a little further and say, okay, well, is that because you've had a uterine ablation, or did you have a partial hysterectomy? And so if she says that she had an ablation or a partial hysterectomy, then we want to do some lab work to see, are those ovaries still functioning? Mm-hmm. So we would draw an FSH and LH at that point to determine, are the ovaries still functioning or not?
It does actually occur occasionally that a 35-year-old woman goes into actual biological menopause prematurely, right?
Yes.
So there could be, that could have happened in the absence of any other pathology, right?
Absolutely. Women in their 20s even we have that are menopausal due to surgery or some other medical intervention.
Right.
But I think what you might be leading into is the 35-year-old that is not menopausal, has not had any of those issues. Right. We get those phone calls day in and day out, so Angie can kind of tell you what she hears and what we hear, because they're just like men. They're so underserved. They don't have anyone to go to. They don't have a good outlet or resource, even whether it be a forum or online either, but they're no different than men. No sexual desire, no libido, weight gain, fatigue, and the list goes on. I mean, they will tell you, I'm mean. My family doesn't want to be around me. I know I've got issues, but I don't know what they are. My doctor tells me that nothing wrong. Here's your antidepressant, and so let Angie tell you some of the stories that she hears. So, treating
with SSRIs instead of with sex hormones. You and I have spoken about that several times, and that is just laziness and duplicity on the part of low-level medical practitioners is all it is. I can't tell you how many guys that I know that have been handed a Prozac prescription instead of a testosterone prescription. And it's just bizarre to me that this still goes on. And I guess it's comforting to know that it happens to girls too, huh?
I think it happens more to girls.
Hey,
right?
Let's something you may not realize. Do you realize that a healthy premenopausal woman, they have 15 to 20-fold higher testosterone levels than they even do estradiol. It is quite a woman's hormone too. They don't need as much as men.
Yes, sir.
But it is their most abundant gonadal hormone. Now, we've talked about this many times. Men can hardly get treatment. Now, imagine women.
Right. The problem is that doctors are very badly educated.
That's it.
We're not educated in this at all. Not at all. Not at all.
They're very, very badly educated. It's just a general observation from a lay person. I guess you could consider me a lay person. Doctors are trained. They're not educated.
That is correct.
That's a problem. That is a problem.
And when you consider that the medical schools are funded by the pharmaceutical industry, of course they're going to heavily influence what gets taught to these young physicians that are going to come out and prescribe their products.
When you
that's
consider
what it
that
all
the
boils down to.
FDA is funded by the pharmaceutical industry,
That's correct.
that's kind of a problem too, isn't it?
Yeah.
We've got lots of problems, and I don't know that there is a systemic solution to this, but I do know that there are offices such as yours that are approaching this correctly, and the bottom line here is that you, the patient, need to take responsibility for these.